Donating blood regularly can reduce toxic forever chemicals in your bloodstream. A recent study showed that donating blood can also benefit donors. Regular blood donation can help reduce the levels of some toxic synthetic chemical compounds known as forever chemicals, or PFAS, which are a global health concern. PFAS, or per- and polyfluorinated alkyl substances, are found in common household objects such as non-stick pans, stain or water-resistant materials, as well as paints, carpets, and clothes. They are persistent in the environment and can accumulate in our bodies over time. They have been linked to a range of negative health outcomes. Firefighters have historically been exposed to firefighting foams that contain high levels of PFAS. The study involving 285 firefighters revealed that regular blood and plasma donations over a 12-month period significantly reduced levels of a commonly found toxic chemical, PFAS perfluorooctane sulfonate, PFOS, in their blood. While both regular blood and plasma donations were effective at reducing PFAS levels, plasma donations were more effective and corresponded to a 30% decrease. Reductions in PFAS levels from blood or plasma donations may be because PFAS are bound to proteins primarily found in the serum. Many other organic pollutants are bound to fats. Plasma PFAS concentrations are also about 2 times higher than blood PFAS concentrations, which could make plasma donation more efficient.
Researchers developed a blood test that could predict a person's risk of death with an accuracy of over 80% for a decade ahead. In this study, blood samples were taken from 44,168 people, and researchers identified 14 biological molecules in the blood that can forecast a person's risk of dying from any cause in the next 5 to 10 years. These biomarkers are involved in various biological processes, including immunity, glucose control, inflammation, and the breakdown of fat and glucose. A score based on these molecules indicates a person's risk of death, with a higher score indicating a higher likelihood of earlier mortality. This advancement in blood testing is also evident in the detection of various diseases. For instance, the CancerSeek blood test can detect 8 different types of cancer, including ovarian, liver, stomach, pancreatic, esophageal, bowel, lung, and breast cancers. CancerSeek can identify cancerous cells by detecting tiny amounts of DNA and protein released into the bloodstream by these cells even before symptoms appear, and it accurately predicts the type of cancer in 83% of patients. Similarly, a blood test has been developed to predict premature birth with up to an 80% accuracy rate, estimating the fetus's age and delivery date. Additionally, a blood test can predict kidney cancer up to 5 years in advance by measuring the levels of a protein molecule called KIM-1 in the blood. Higher levels of this protein indicate a higher risk of developing kidney cancer. Another blood test can forecast the risk of a heart attack up to 7 years in advance by detecting the levels of a compound called TMAO, which is associated with blood clots. These innovative blood tests offer early detection and prediction of various health conditions, potentially increasing the chances of survival and improving overall health outcomes.
Your blood type could predict your risk of having a stroke before age 60. The number of people with early strokes is rising. These people are more likely to die from the life-threatening event, and survivors could live for decades with disability. Despite this, there is little research on the causes of early strokes. But a recent study has found a link between a person's blood type and the risk of having an early stroke. The findings are based on a meta-analysis of all available data from genetic studies focusing on ischemic strokes. Ischemic strokes are caused by a blockage of blood flow to the brain, occurring in younger adults under age 60. The study uncovered a link between early onset stroke and the area of the chromosome that includes the blood type gene. People with early stroke were more likely to have blood type A and less likely to have blood type O. Blood type O is the most common blood type. Both early and late stroke were also more likely to have blood type B. Those who had blood type A had a 16% higher risk of having an early stroke compared to other blood types. Those who had blood type O had a 12% lower risk of having a stroke than people with other blood types. The researchers still don't know why blood type A would lead to a higher risk, but it likely has something to do with blood clotting factors like platelets and cells that line the blood vessels. The researchers emphasized that the increased risk was very modest and that those with type A blood should not worry.